I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video edition on your full thickness transplant. If you are coming to see me for a full thickness transplant, it is likely a revision transplant. I rarely do primary full thickness transplants. What that means is your vision is impaired because the transplant you already have has failed for some particular reason. Now those reasons usually are the shape is really irregular, so you cannot be corrected with glasses. The cornea has failed and become swollen, or it has rejected. Now to step back a bit, what is a full transplant? It basically is when the front of the eye, the dome, literally a punch goes through it, takes that off, and we replace it with donor tissue. That is a full transplant. How that is secured into your eye will vary. Generally it's stitches, but we can use lots of little ones or one long one or a combination. What we end up doing depends on your pathology, and it depends on the disease that's happened to cause you to reduce vision after your transplant. Now, transplants fail. Full transplants will always fail. They are not going to give you permanent vision unless you're, say, 80 and you have a full transplant and you die when you're 85, then it works till you're dead. But for younger people having it done, it is likely that there will be a failure rate. They can be anywhere from 1 year to 50 years, and it's very hard to say why or how long. So that's what a full transplant is, and when you come in, we'll measure you up and work out what size of a transplant to put in for you, and we'll generally talk to you about the anesthesia, which is mostly a general anesthesia. The reason we use a general anesthesia is because when we take off that cornea, your eye is actually open to the sky, and if during that procedure you were to, say, cough, the pressure in your eye can go up, and you can lose the entire contents of your eye and be permanently blind. So for that reason, we control the surgical environment and generally recommend a full anesthesia if you're well enough to have a full anesthetic. So that's what a full transplant is. The other thing to think about is that a full transplant has the usual post-op recovery period, 3 to 18 months. Some people get their vision back quick and some people take a long time, and sometimes other things need to be done. It is not it's a blank canvas, but it is not something that I can give you an accurate prediction of when. And if you have a cataract in that eye, you will then need to go into cataract surgery as well. So there's a whole lot of little steps to do, but we can get you there and restore your vision. So that's what a full transplant is. Thanks for watching. I'm Dr. Anthony Maloof of Corneal and Oculoplastic Surgery and Eyes and Faces in Sydney.